My name is Rosie Morris. I'm a physiotherapist and PhD student, and I'm presenting some work on the impact of attention on walking. So many of you know the ICICLE study. It's the incidence of cognitive impairment in cohorts with longitudinal evaluation in Parkinson's disease. And the ICICLE study uses a number of measures which are displayed on the screen here. And the ultimate goal is to determine different tests which are able to identify people with cognitive problems or Parkinson's disease dementia. So for the ICICLE study, we do a number of things such as blood tests, we do different brain scans, we look at quality of life, we look at different cognitive tests, and we also do clinical assessments such as blood-based markers or CSF, for example. The focus here is on ICICLE GAIT. So ICICLE GAIT is one of the sub-studies of ICICLE, and this is looking at both walking and balance and its relation to the onset of cognitive impairment or Parkinson's disease dementia. So this presentation is going to talk through three aspects of the ICICLE GAIT study. So we have data collected in the home environment where people wear small monitors on the lower back. We have data from the lab environment where people come into the GAIT lab and we measure their walking using equipment, and we also ask people to complete falls diaries. The first focus of this talk is going to be on some of the data that we've assessed from the laboratory measurements of walking. So as a little bit of a background, we know that cognition declines in people with Parkinson's disease. So this isn't just memory problems, this can be problems with attention, executive function, so decision making, language, as well as visual spatial problems. But we also know that walking deteriorates in Parkinson's disease, and this again occurs with a number of different aspects of walking. Walking isn't a simple task. It can be split up into different aspects. So for example, pace, how fast do you walk? Variability, how different are you from left to right? How variable are your steps from one to the next? The rhythm, what is the timing of your walking like? Asymmetry, how does your right differ from your left? And postural control looks at different aspects of balance of walking. The talk here is looking at the relationship between the two. How do cognition and walking relate? There was a publication from our group recently which showed that in baseline Parkinson's, that's people who'd just been diagnosed, and there was a selective pattern between cognition and walking. So certain aspects of cognition, namely attention, were related to aspects of walking, such as the speed of walking. And this shows that not only is there's possibly certain areas of the brain that might relate these two together, but that also walking may be used as a predictor for cognitive decline. So a number of studies have shown that GAIT predicts cognitive decline in older adults. So this study has assessed people's walking and monitored both their walking and their cognition over 7 years. And they've identified that certain parts of walking or certain aspects of walking were able to identify those more at risk of cognitive decline and dementia, and also different subtypes of dementia. However, no similar studies have yet been completed in Parkinson's disease. Therefore, we need to know if walking early on in the disease is able to predict cognitive decline in the future and possible Parkinson's disease dementia. And this would lead to what we call a biomarker. And a biomarker is ideally a simple test which identifies somebody at risk. So here it would be a simple walking test that wouldn't take very long that your doctor could perform. And this would be added to a tool of batteries which would be able to identify those at risk of cognitive decline. In turn, this may lead to earlier treatment management, whether it be medication or therapy, and it would also give us further understanding of the underlying mechanisms between gait and cognition and how are these two aspects related. So a bit of methodology from the study. So our participants are asked to walk at their normal pace for 2 meters around a circuit which is shown here on the screen, and this includes a 7-meter gait-right mat. A gait-right mat is a pressure sensor mat which identifies the pressure of different footfalls over the mat, and this can calculate different aspects of walking. So from this we get a number of domains, as I mentioned previously. We measure 16 actually different things of gait, which then can load onto these domains: pace, rhythm, variability, asymmetry and postural control. And this gives an idea of somebody's walking. We then ask people to perform a number of tests So this includes global measures such as the MOCA and the MIMSI, but also a number of computer tests, so tests of attention or executive function, as well as visual spatial tests. So just some really brief results that we found in the lab so far, and this work is currently underway, but this was some analysis in 51 people with Parkinson's disease. And here we looked at the velocity of walking as well as the step length, so how long each step was, or the mean of the step length, compared to the change in fluctuating attention score. So the speed of walking was measured at diagnosis, and the change in fluctuating attention was calculated over a 3-year period. And here we can see that those with a slower walk or a shorter step were more likely to decline in their score of fluctuating attention compared to those who were faster or had a longer step. Now, although this was very subtle, it shows that a simple test of walking may be able to predict a change in levels of attention. More importantly, the results from walking and step length were more sensitive than that of cognitive tests. Cognitive tests were not able to predict the same decline, and therefore it may also show that walking is a more sensitive biomarker or sensitive predictor than cognitive tests themselves. So now I'm just going to go on to talk about measurement in the home. So in the clinical setting, we obviously have a lovely gait-right mat and we have different cameras, but this is unrealistic for the majority of patients, as they don't have access to this expensive equipment and they don't have the space or the time to do such analysis. However, analysis can now be brought into the home or into the clinical setting by wearing small monitors on the lower back, as shown on the screen here. These small sensors allow for the same measurements to be collected in the home or the clinical environment. The same gait characteristics as mentioned previously are able to be measured. And this allows an easy assessment which can take place in the clinic or the home. And therefore we can look at the same cognition and gait relationship in the home. And now moving on to falls diaries. Falls diaries are also another aspect of the icicle gait study, and we ask people to complete these falls diaries every month. So this asks information about where you were when you fell, what you were doing at the time, what caused the fall, how did you land, and how did you get back up from the floor. And this gives us more information about falls and how they occur. And participants have been sent these monthly diaries since the study began, and some participants have been sending these diaries for over 5 years, so we're very grateful for all the hard work that our participants have put into the study. And so far we've used the information to further understand falls in early Parkinson's disease. We've found a new way to classify falls. So this was a paper recently published by Karen Maktia looking at the relationship between ambulatory activity, so you're walking in the environment, and how falls occur, and classifying them according to pre-fall activity, so what was the participant doing before the fall occurred. And this just allows us to classify falls in a different way as opposed just to quoting number of falls. There's also work underway identifying those most at risk of falls. So are there certain characteristics of gait or certain aspects of cognition? We should identify those at risk of a fall before the first fall occurred. And we've been able to calculate this using the data we've collected using the falls diaries. This is important as the number one risk factor for a fall is a previous fall, and therefore if we can prevent or prolong the time before the first fall, this would help a lot of patients. So what's next? Well, the icicle study and the icicle gait study is ongoing, and ideally what we want is a battery of biomarkers to identify those at risk of cognitive problems. So we want a toolkit which includes a number of basic tests, including gait, as well as sort of blood-based markers and imaging. Thank you very much.